Good morning again, everyone. Again, this is Jim Sacchetta with Ariadne Labs, and I'll be your host today for today's fourth webinar in the BetterBirth Safe Childbirth call series. We really appreciate you joining. I know we have a small group, but we'd like to get started so that we remain on time. We have a great topic today in coaching, and I'd like to just quickly run through some WebEx information with all of you. We'll be using some functionality in WebEx for both polling, chatting, and any question and answer that we have throughout the event. If you look to the right-hand side of your screen, we have a few functions that we'll be using. One is the raise your hand function. We'll be using that later in the call to get some discussion going. If you use that raise your hand function, I'll be able to unmute your line so that you can ask any questions to our group of panelists. We'll also be using the chat function, so you can use that at any time throughout the call and get your questions into us, and we'll be able to raise those for you. I'd like to introduce both Emily George and Jeff Durney, who will be leading us today. And I'm going to kick them the ball, and they can get things started for us.
Thank you so much, Jim. Good morning, everyone. My name is Emily George. I am a clinical implementation specialist and nurse liaison at Ariadne Labs, and we're so excited that you joined us this morning. I want to just take a minute and introduce Jeff Durney. He is going to be talking to us a little bit about coaching, and he is the Senior Program Manager of Human Factors and Process Improvement at Dana-Farber Cancer Institute. And then later in the call, we're going to be hearing some stories from our colleagues in India. First, we'll hear from Dr. Tapan Kalita, who is the Senior Program Manager of our BetterBirth Program and Population Services International. We'll also hear from Arti Singh, who's a Program Manager as well with the BetterBirth Program and Population Services International. But before we hear from them, I wanted to take a quick poll and learn a little bit about you. If you could just tell us what is your professional background, and you can select all that applies here. So I'll give you a few minutes to answer that.
Thanks, Emily. Everyone, the poll is open, and it should be located on the right-hand side of your screen. If you just want to take a moment to select your profession or select all that apply in regards to your profession and hit submit, we would appreciate that. Emily, the poll results should be available now.
Okay, great. It looks like we have some people from a variety of backgrounds, but mostly in the public health field. Wonderful. Thank you, everyone. So today we are going to be talking about coaching, but I just wanted to give you a little recap of what we've been talking about so far with our webinar series. We have designed these webinars to actually share lessons learned across all of our programs here at Ariadne Labs. The BetterBirth Program, the Safe Surgery Program, and the Serious Illness Program. And on our first webinar, we actually walked through the checklist itself. And we found that when we just gave people the checklist, that handing them that doesn't actually work for successful implementation. But there is a pathway that we like to take people on that actually lays a really solid foundation for successful implementation. And on the first webinar, we went through each of the components on the checklist, and we talked through the rationale behind it, that each of these pause points was developed based on essential birth practices that are internationally recognized to improve maternal and newborn health. And we also talked about how checklists have been shown to improve quality and safety in other industries, like the aviation world. And then we talked about how we could actually look and use the checklist to identify gaps in our own current practices within our facilities and determine ways that we could move forward as a team and improve communication and teamwork overall. And then on the next webinar, we actually spent time talking about how to engage leaders and what this meant, the importance of buy-in, and actually talking to the people that were going to be responsible for championing the implementation of the Safe Childbirth Checklist. And we talked about how important it is to actually find someone on your team that's going to help support this on a daily basis. And on this webinar, I don't know if you remember, but we heard from Dr. Ogu from Nigeria, who is one of our champions for the checklist internationally, and she shared some of her experiences with this process. And then on our last webinar, we spent time talking about launch. And what we mean by that is what it means to actually start the implementation. We walked you through some practical tips and tricks for conducting an event where you gather everybody together and motivate them, share inspiring stories, and actually spend time addressing their concerns or any barriers to implementation within your facility. And that was on our last webinar. And today, we're actually going to spend some time talking about how to sustain checklist use. And we believe that we can do this through coaching and measurement and data feedback. And specifically today, we're going to talk more about what it actually means to coach someone and to offer someone support through implementation. So today's outline, you can see on the slide, is we're going to talk about what is coaching, decide when and how to coach, and how to give feedback and reflect on learning. And then we'll actually give you guys some time to practice coaching. And so with that, I'm going to turn it over to Jeff Durney.
Great. Thank you so much, Emily. It's a pleasure to be back here at Ariadne Labs today talking to you all about coaching. So first, let's talk a little bit about what coaches do. And the first thing they do is really listen and observe people performing some task of interest in their natural work environment. And they ask questions to gain a better understanding of why people are behaving the way that they are. And Emily will talk a little bit more about how to frame these questions in a few minutes because, you know, it's really important that you take the time and put some care into how you actually ask questions as a coach. And coaches also help people learn to reflect on their own behaviors and how to improve over time. And in fact, I think this is one of the most powerful things that coaches do. They help people come up with their own ideas on how to improve their performance without really forcing the coach's ideas upon them. And skillful coaches, they're not really problem solvers, but they bring out the problem-solving abilities in the people that they're coaching, almost like a guide on a journey, if you will. And I've worked a lot on quality improvement projects over the years, and by far the most successful ones were the ones where the teams I was working with really came up with their own solutions to the problems that they were facing. And, you know, to change adult behavior, the individual needs to see the problem and then also see the solution for him or herself. And this really greatly increases the odds of a change actually sticking over time. And so I've been coaching now, you know, in some capacity for many years, but I've also been the recipient of coaching, and I've also been the victim of some pretty bad coaching, to be honest. And I openly admit that I've made mistakes as a coach myself. Let me just start by saying coaching is not easy, so don't ever think that it is. But so let's talk a little bit about what coaching is not. And so it's not telling people how to perform or teaching them. That really comes earlier. The assumption in the coaching relationship is that people are smart and they've already received the training that they need to be successful. It's also not about criticism. As an adult learner, ask yourself the question, how well do you receive constant criticism of how you're doing something? Does that make you get any better? You know, adult learners are not going to improve just because somebody keeps telling them over and over again that they're doing something wrong. On the flip side, though, coaching is also not just about constant praise either. And this is my biggest weakness as a coach because, honestly, I love making people happy. But, you know, I once listened to a recording of myself doing a coaching session, and I couldn't believe how many times I said words like great and excellent and awesome. I found that, you know, I was being more of a cheerleader than a coach. And I learned a lot in listening to that session, and it made me a better coach in the long run to reflect on that. Now, there's nothing wrong with wanting someone to succeed and, you know, providing some encouragement to help make that happen. But to be an effective coach, you really have to strike a balance between the positive and the negative. And finally, coaching should not be confused with auditing. There's a time for auditing, there's no doubt on that, but people respond differently to that. Auditing is really a means of checking that something has been completed to the standards that were expected. It's not really an opportunity to improve upon what's been found, at least certainly not in the short term anyway. And the word auditing itself has sort of a negative connotation to it. And real coaching is a much more positive activity. It's a chance to really identify improvement opportunities in real time and then help generate some real improvements. So keep your auditing and coaching separate. And so what traits do good coaches have in common? First, I think effective coaches really are those people who are coachable themselves. They're motivated by the goal of improving their own practices. And effective coaches really should be trusted and respected by their peers. If not, they won't really be taken seriously by the people that they're trying to coach. And good coaches are humble and self-reflective people when it comes to their own shortcomings. And these qualities really enable them to build successful relationships with their colleagues because, let's face it, no one's perfect. People who carry themselves like they have nothing left to learn or that they have it all figured out can really be off-putting, especially in a coaching relationship. And I think we all know people like this in our lives. And people won't be very receptive to feedback coming from someone like this. And so good coaches also, they have patience and flexibility to allow others to really learn by reaching their own conclusions. And this takes time, and an impatient, rigid person likely won't be willing to wait for something like this to happen naturally. So, and I think finally, it also goes without saying that, communication skills are critical in a coaching relationship. The trouble with this is, we're generally not taught how to communicate effectively. And so the result is that some people just are better at it than others. But we'll give you some advice on how to get better at it in just a moment. And then finally, and I think this is probably the most important quality in a good coach, and that's genuine curiosity. I approach all coaching encounters with a real desire to learn from the people that I'm coaching. Why are they behaving the way they are? What barriers are keeping them from performing at their very best? Not from a judging standpoint, but from one of empathy and just a strong desire to really help them help themselves. The opposite of this is really coming in with an assumption that the coach has all the answers and he or she is there to fix people. You won't go far as a coach if you have that attitude, trust me on that. And so now I want to hand it over to Tapan, who's going to talk a little bit about the BetterBirth program and the coaching approach that's used by the program.
Hi everyone. I'm really pleased to speak with you all today about my experience with coaching in BetterBirth program. I feel privileged to be associated with this program for the last 3 years. I'm Dr. Tapan Kalita. But first, I would like to talk briefly about the background of our program. BetterBirth program is a matched pair clustered randomized controlled trial being conducted over 120 primary healthcare facilities across 24 districts of Uttar Pradesh, which is the most populous state of India. Out of these 120 facilities, 60 are the intervention facilities where we are testing the WHO Safe Childbirth Checklist and coaching as an implementation strategy. And the other 60 are the control facilities. We are aiming for effective and sustained adoption of the WHO Safe Childbirth Checklist through coaching-based implementation and to make an assessment of its impact on maternal and early neonatal health outcomes. The existing no-do gap in childbirth practices forms the basis of the rationale of our program. So we all know that if the essential birth practices like providing skin-to-skin care to the newborn or recording of fetal heart sound or monitoring of vitals, etc. So if these essential birth practices are performed properly, that can actually improve the health outcomes for mother and the newborn. But in reality, not all essential birth practices are being exhibited by all birth attendants at every childbirth event. So we are focusing to bridge this gap through peer-to-peer coaching. Peer coaching is the heart of our coaching implementation. It's a model which emphasizes on providing hand-holding and support through same peer groups. In BetterBirth, we have two distinct cadres, the coaches and the coach team leaders, who visit each facility to provide coaching to the facility people. Coaches are the trained nurses who work closely with the birth attendants, who are basically also nurses, and the team leaders are medical doctors or public health professionals who work in close conjunction with the facility head or the doctors in the facility or even the district health officials. So through peer coaching, we have been able to build a very strong relationship with the facility people and also district officials. We have been able to ensure building of trust, open communication, and yes, the removal of the feeling of hesitancy which is usually associated with hierarchy. We also have been able to garner tremendous amount of respect from all these people over all these years. So I would also like to talk briefly about certain aspects of peer coaching. For example, the first aspect that I would like to talk about is the client-centric approach. In BetterBirth, we have adopted a client-centric approach. So prior to the commencement of coaching visits, we conduct the engagement meetings and launch training with the facility staff. So where we do a need assessment or a gap analysis exercise just to understand about the existing gaps in the quality of care from the perspective of the caregivers. So this helps us to be focused to work on those gaps from the very beginning. The second aspect of peer coaching is the collaborative approach. We work through a collaborative approach with the facility staff. We ensure that their views, opinions, and suggestions are incorporated, and every issue is addressed through effective teamwork. Yes, at the very context, we also ensure that effective use of local resources takes place. Our coaches and team leaders are encouraged to identify and mobilize local resources in addressing the knowledge gap or skill gap or even supply or process related gaps. We do not impart any direct skill training, or we do not provide any supplies to the facility. Another very important aspect of peer coaching is the focus on building capacity of a local champion. In every facility, we try to identify a local champion, which is a very well-respected person in the facility, who is very dynamic, responsible, proactive, and also very much motivated to ensure quality childbirth services in his or her facility. After identifying him, we try to build his or her capacity so that he or she is able to facilitate problem solving within the facility, and also can encourage other facility staff to use the checklist properly. So after that, I would like to talk about the OAMS framework. OAMS is a framework that describes the barriers to consumer behavior. We all know that the BetterBirth program is a behavior change program, and it becomes really imperative for us to try to find out and understand the exact root cause or the barriers that prevents a person from conducting specific activities. So in BetterBirth, we have been successfully using this framework for identifying and categorizing the barriers to essential birth practices. So the OMS barrier, O stands for the opportunity barrier. It refers to the environmental and the contextual factors that individuals do not have any control over. For example, sometimes some important tasks can be skipped or left because the nurse on duty suddenly gets really busy and there are time constraints and she becomes overworked. If it happens because of a genuine reason, environmental or contextual reason, then it would be regarded as an opportunity barrier. A stands for ability barriers, that refers to the required, the absence of the required amount of knowledge and skill and technical confidence for conducting a particular activity. Sometimes some of the birth attendants that we come across do not exactly know how to measure the fetal heart sound using a stethoscope or to take blood pressure using a sphygmomanometer. So in those cases, if that particular birth attendant has a skill related or knowledge related barrier, then it will be regarded as an ability barrier. The third category is the supply barriers. So sometimes there is non-availability of a particular supply item, be it a drug or medication or an instrument, prevents a particular birth attendant from conducting a particular activity, then it would be regarded as a supply barrier. Well, the fourth category is the motivation barrier, and that is the most difficult to address. It basically refers to lack of an internal drive or a belief or a willingness or enthusiasm to perform a task. So sometimes, despite having the opportunities or the ability or even the supplies, a particular birth attendant may not at all be interested or motivated to conduct a particular activity. So that would be a motivation barrier in that case. So it is really intriguing how this OMS framework gives us an opportunity to explore an individual's mind to understand what is actually preventing that person from performing a task. It's a comprehensive approach of keen observation, open and close-ended questions, and analytical thinking, using which we gradually, layer by layer, arrive at the root cause and decide upon which specific strategy we will have to use to remove that root cause. We have many such examples in our program of how we zero upon a specific barrier. I specifically remember this birth attendant who did not used to measure fetal heart sound and told us that she did not know how to measure it. So apparently the barrier seemed to be ability barrier, but on my successive visits when I tried to explore further, we got to know that she actually was not at all interested to measure the fetal heart sound, as she believed that it was not worth it to invest time and effort in taking fetal heart sound, and that it is fine to skip fetal heart sound. So the barrier was actually a motivation barrier, and it was finally removed using specific motivational communication strategies, and she finally started measuring fetal heart sound. So we have many such wonderful stories in our program. Birth attendants who never acknowledged or accepted their shortcomings became very open and forthcoming gradually over time. Some even said that they felt empowered to solve the problems by themselves within their own facilities. So it's been a really beautiful journey, and this framework has tremendously helped us to work upon behavior change, starting from individual to the facility level. Thank you so much. Hi, everyone.
Great. Thank you so much, Tapan. I think one thing I really love is this idea of closing the no-do gap. I think that's a great way to sum up what coaches really do. You know, it comes back to that point I made earlier around, generally speaking, people know what they need to do. You know, they're well educated, and if they don't, then you've got a different problem on your hands. But once they know what they need to do, they then need to execute on that knowledge and actually do some of the things they're supposed to do. And I think that's where the coach really comes in, and where the coach can really help close that gap. So great points there. Okay, so let's, an important decision to be made, you know, when you're going to start coaching is just to know when and exactly how to start coaching. So let's talk a little bit about that. So today we're focusing on coaching within the context of childbirth, but these tips can really be applicable to other settings as well. In the past, I've coached teams in the use of the WHO Surgical Safety Checklist using these same principles that we're talking about here, and it was just as effective. So you always want to start with a team that you're pretty sure will be receptive to your feedback. Don't be brave and pick a really challenging team to start with, and then be completely transparent about what it is that you're up to. Remember, the idea of distinguishing between coaching and auditing is also very important, and this is really where that comes into play with transparency. And then focus on the pause points that we talked about earlier and observe whether or not the desired behaviors are being performed and how they're being performed, and if not, why not? And then find the appropriate time and place to share your observations. For example, you know, at the end of the day or when there's a break in the day. Interrupting people to offer feedback, you know, unless there's really an imminent threat to patient safety, is really not a good idea, and it really, you know, may in and of itself jeopardize safety. So, an organized coach is an effective one, and I firmly believe that. An observation tool like the one seen here really helps to standardize coaching across the facility and across multiple coaches. And it really serves as kind of a checklist for the checklist. This one's for the Safe Childbirth Checklist, but we've also used a similar tool in our surgical work. And it really helps the coach stay on track while observing a team and sets the stage for the feedback that the coach is going to deliver later. And an observation tool like this really can be filled out during the case or immediately after. I personally prefer doing something like this while I'm observing because I just find it easier to remember every little detail, while I'm in the moment rather than waiting until after. I tend to forget. But if that's not an issue for you, then feel free to complete it soon after the case is complete. Just don't wait too long, though, because all of our memories degrade with the passage of time. And there might even be an advantage, actually, if you think about it, to waiting until after the case is complete, because some people may feel uncomfortable with the idea of somebody writing things down while they're working. It can feel a little like Big Brother hovering over your shoulder when you see somebody watching you and writing things down that you're actually doing. So always do what you can just to put people at ease. I think that's the point I'm trying to drive home here. And again, transparency here is really important. Tell the people about the observation tool and explain its purpose beforehand. If you don't, they might interpret what you're doing as auditing them, and that this is some kind of a performance report card that you're filling out and that they're going to hear about later. To that end, avoid using anything that's identifiable. Keep identifiable information out of this when you're using a tool like this. And remember, at the end of the day, this is not personal, and so that's an important point to drive home. So now I'm going to turn things over to Arthi, who's going to share her experience with coaching and talk a little bit about some of the supporting relationships that she's built as a coach.
Good morning, all. This is Arthi from PSI BetterBirth Program. I'm based in Meerut, Uttar Pradesh, India. I'm very happy to share some of my experiences in coaching today. The foundation of my coaching is based on building a good rapport and relationship with the birth attendants that I coach. I like to think that we are friends and we are supporting them rather than observing them. Once we are able to establish this positive rapport, the facility staff and birth attendants become more familiar with us and open up. In any instances, they even ask me for feedback. When it comes to deciding when to coach, I try to be very flexible and I try as best as I can to adapt to the birth attendant's schedule and convenience. I try to get a good sense of her feelings and consider if she might have other commitments or stressors during the coaching visit. For example, if the head of facility has asked her to prepare a report or if she had a lot of paperwork to do, I would try to find another time to coach when she's more focused and less distracted. I have found that keen observation of the birth attendants and asking open-ended questions help a lot when I'm considering whether it is the appropriate time to coach or not. I would like to share an example with you all that was a good learning experience for me. In one facility I worked at, my coach and I had the opportunity to observe a birth attendant who was working with the patient soon after birth at pause point 3. We were also able to observe her working with another patient before discharge at pause point 4. For both of these patients, the birth attendant did not check to see the mother's bleeding according to the checklist. Later in the day, my coach provided feedback to the birth attendant without first knowing whether the birth attendant was in the right frame of mind to receive feedback. By asking open-ended questions and then through some light conversation, we soon realized that the birth attendant was actually very upset due to some personal problems at her home. The birth attendant shared that she knows the importance of checking bleeding, but right now she is not feeling good. She needed some time and left the facility. This experience taught me that timing is very important. Since then, I always try to access the birth attendant's frame of mind before starting coaching on a particular topic.
Wonderful. Thank you so much for sharing that, Arti. I think it's very important, as she said, to really consider the factors that are going on with the people that you're coaching and give them an opportunity to talk through some of those things and not just assume the worst, but to always, again, not have assumptions and come in with those open-ended questions. So we're going to talk now just about how to give feedback and reflect on learning. And you can see here this picture of this sandwich. Maybe many of you are familiar with this if you have gone through any type of management class or communication class. And it's this standard idea that this is the way that you give feedback during classic supervision. And so an example of this would be, you know, Jeff, you have completed all of your projects on time. However, you really push your deadlines. But keep up the good work. So the idea is that you put the thing that they need to improve in the middle of 2 points of praise. However, with coaching, we want to take it one step further because coaching, as we said, is different than classic supervision because as a coach, you want to observe and ask a question that is going to allow the learner to reflect on their behavior and come up with a solution themselves. And the way that we have come up with like a framework that could be helpful is yes, we agree that you should start out with praise. And then in the middle of that place where you're supposed to give maybe a negative or a room for improvement is to put in this method of stating your observation, providing your thoughts about why you think it's important for them to complete that portion of the checklist, and then ask them a question to give them an opportunity to express perhaps why or to come up with a reason for themselves that would help them remember next time, and then to end the conversation with praise. And so an example of that may be to say, Jeff, I noticed that you completed every portion, almost everything on pause point 1. You did a fantastic job going through it and using the checklist. However, I noticed that you did not take mom's temperature when she came in, and it's very important for us to do that to assess for fever or an infection. And I was just wondering what happened there. And then that gives Jeff an opportunity to maybe tell me, oh, I actually forgot. I was doing something else, so thank you. I'll remember to look at the checklist next time. Or that may be an opportunity for Jeff to say, oh, the other nurse actually took the temperature. And so as the coach, I do not need to make assumptions. And so maybe at that point, he's providing information that's going to help me more fully understand why that task wasn't completed. And so, again, the overall message with this is that you want the team to be able to reflect back to you or the individual for themselves why a task wasn't completed and to really come up with a solution themselves if indeed it was missed. So now we're going to turn it back to Arti to give us an example from her experience in India.
For giving feedback, I always remember this one example. We had a great champion at the facility who was a lady medical officer. All 4 birth attendants at the facility really admired the lady medical officer. There was one birth attendant at facility who used to run here and there for collecting essential items for the mother and baby during the delivery time. We had observed her once and found that she was not keeping essential supply items prepared in a tray and ready to use at the bedside. This included having injectable oxytocin loaded in a syringe and ready for administration soon after birth. While the birth attendant could improve in this area, she was doing many other things very well. For example, she did a great job at initiating a skin-to-skin and was able to follow pause point 3 as per the WHO Safe Childbirth Checklist. We found an appropriate time to give the birth attendant feedback and also included the facility's champion in the conversation as well. We started the discussion with sandwich feedback. I appreciated the birth attendant's wonderful work on skin to skin, and pause point 3. I explained to the birth attendant that there was only one practice that was not as per the checklist. The birth attendant immediately answered that yes, I was not able to have all the supplies ready for use at the bedside, and as a result there was a delay in administering oxytocin to the patient. The facility champion also provided encouragement and motivation that all supplies should be kept prepared and ready for use in trays. After this discussion, our champion and all the birth attendants all worked together to prepare and organize supplies for delivery. The birth attendant from then on promised that she would take care of supplies in advance. I appreciate the birth attendant for her hard work and also thanked the facility champion for her positive support and involvement. This was an interesting example on sandwich feedback because through our discussion with the birth attendant, I was able to confirm that she clearly knew about the importance of preparing supplies at pause point 2. There was no ability barrier. Rather, there was a clear motivation barrier. The OAMS framework helped me to think through and identify the underlying barrier to the issue, and it was great to work with the team and have them come up with their own solution.
Thank you so much, Arti, for sharing that. And now I'm going to turn it over back to Jeff.
Thanks so much, Emily. Okay, so we're going to practice this a little bit because I really believe that practicing this idea of how to give feedback is really important because it's not really the natural way that we speak. You know, it's not something that we think through, but if we put a little time and effort into practicing it, we can get better at it. So I'm going to set up a little scenario here, and what I want you to do is tell me how you would frame your feedback for the team using the method that Emily and Arti just described. And so if you could put your responses into the chat box, you should see it on the right side of your screen there. And I think we should be set up so that everybody can see that. And so the scenario that we're going to set up here is at pause point 1 on admission, the nurse did not wash his or her hands prior to performing a vaginal exam. And so what I'd like you to do is think about how you would give feedback using the method that we described. And if you could put it into the chat box there, that'd be great, and we'll kind of take a look at what folks are saying. And then also, too, I'll give you the option if you want to be brave and raise your hand, you can use the raise hand icon there, too, and you can actually speak with us live and talk through the scenario. I'll give folks just a minute to craft their responses. So you're a pretty quiet group so far, but I'll wait patiently here and give folks a chance to enter some observations in the chat box there. And remember the framework too. It's all about what you saw, what your opinion is about the situation, and then frame the feedback in a question to get more clarity on what you saw. And I'll take it back here just to remind you what that framework looks like. So again, observation, thoughts, and then questions. Thanks, Jim, for the reminder in there. Just reminding folks, too, that we'll take your responses in the chat box there. So feel free to start typing away. Okay, looks like we do have a response here. So it says, initially give praise, and this is from Paula quickly, I should say. It says, initially give praise on what they did well, then note the lack of hand washing, and then ask about any thoughts the person had and end with another praise. That's good, absolutely right. You're thinking of that idea of sandwiching the feedback between two pieces of praise. I like that, absolutely. And then what else do we have here? Let's see. You gave a gentle vaginal exam. I observed that you did not wash your hands. I think it is important to do this to prevent infections. Could you help me understand what prevented you from washing your hands? Perfect, I love that. My friends at Ariadne Labs, I like that. Good job, guys. Exactly. We have one here. This is from, looks like Emily Benson. It says, congratulations, you performed a very good preliminary exam. One thing I noticed was that you did not wash your hands before performing a vaginal exam. I think this is very important for both your safety and health and the safety and health of the patient. Was there a reason that you didn't wash your hands? Do you think it has an effect on your safety? Beautiful, I love that. Good job, Emily. That's great. We have another one here too. Let's see. This looks like, again, from my Ariadne Labs folks. You gave a gentle vaginal exam. I observed, oh, this might be the same one. Could you help me understand what prevented you from washing your hands? Yes, same idea. Perfect. I think you guys get the idea. I mean, that's exactly how this type of feedback should be structured. And it's really important to try to practice that to get good at it. And I just put up on the screen here, too, this is a little reference chart for you with some sample language in here. And some of these we heard in the responses here. You know, just some ideas on how to frame this. You know, I saw, I observed, I watched, you know, things like that. I like the idea of saying things, too, like the team did or the team didn't. Because sometimes, you know, people can feel like they're being singled out if the feedback is delivered to them as an individual versus pointing out, you know, it's a team effort. So, so that's important. And then when it comes to your opinion, you know, I think, I believe, that's that humble piece in there. You know, it's not saying, I know. There are no absolutes in here, but you're trying to frame it from the standpoint of, you know, here's my opinion, and let's have a discussion about that opinion. And then finally the question, can you help me understand? I'm curious why do you think that happened, that kind of thing. I've heard folks say, I need a little clarity on what it is that you did. And again, you're not judging, you're not coming down hard on somebody and saying you did something wrong. You're just starting a dialogue. You're asking a question, and then hopefully that'll lead to a response and maybe a question back at you, and then you get a dialogue going, and then finally you arrive at, you know, what the real barrier is, and you can really help people as a coach. Perfect. Okay, so I'm going to turn it back over to Emily now for another poll here.
Thank you so much, Jeff, and thank you everyone for practicing. And as Jeff said, it's really important to even practice just this format. Sometimes this language doesn't come naturally to us, especially if we have been used to giving feedback in that classic supervision way, and it definitely just takes a little bit of time and practice to actually formulate these questions and think about how to get someone to reflect on their learning in this way. So we want to ask you guys another question here, and we would like to know what additional information about coaching would you find helpful to learn about in another session. And you can select all that may apply, and this will really help inform us as we continue to plan these webinar series. Specifically around coaching, we know that it's a lot of information, and there's still probably a lot that we can cover that would take longer than an hour. So we are looking forward to hearing from you and possibly designing another webinar or providing resources to you that would be helpful when it comes to coaching. So if you could just take a minute and select all that apply here for what you would like more information on, or if you think that you've received enough information too, that would be very helpful.
The poll is open now. It's located on the right-hand side of your screen, and it's going to be open for another 20 seconds or so. Great, thank you, everyone. Emily and Jeff, the poll results should be up now.
Okay, great. So it looks like that that a lot of these would be applicable for providing more information and materials for you. So how to integrate coaching into the flow of care, training the implementation team on coaching, and then how to diagnose and solve barriers appropriately. So we really appreciate this feedback. And again, we will take this into consideration as we continue to form our webinar series and think about what materials would be the most helpful to maybe take a deeper dive into. We definitely have some time now, though, for some questions and answers. If there's anyone that wanted to type into the chat box or unmute their line, we are happy to take a deeper dive if possible into some of these now if you have specific questions, so we can open that up and you can use the chat function or raise your hand, and Jeff and I can answer any questions that you guys may have.
Thanks, Emily. Just to reiterate on the functionality, if you look at the right-hand side of your screen, you'll have a selection of tabs. One is called the Participant tab, and in the Participant tab, you should have a little hand icon. If you click on that, we'll be able to pull your line up, unmute your line, and you can ask your question aloud. And also, feel free to chat anything into the chat box, and I can voice that for you. We just received a question from Paula. The question is, do you have any specific ways of monitoring the impact of coaching? Thanks, Paula.
Hey, Paula, that is a great question. We actually do, and we're devoting an entire webinar on our next time in February on actually measuring and using that feedback to share with the team as well. And what I can do is we can make some tools available to you, but we have actually come up with, as Jeff had said, an observation tool and a way to actually collect the way that teams or individuals are completing the elements on the checklist. And that is actually how we have been monitoring that. And then what we really encourage people to do within their facilities is to take that information back to not only the individuals in the teams, but also to the leaders or the facility head, and to share those findings in meetings, again, not in a personally identifying way, but to actually track and monitor the progress of the facility as a whole, of the places that they're doing really well in, and then also the places where they can actually make improvement. And we really encourage people to celebrate the successes, and then maybe you can come up with ideas like friendly competition or ways to motivate your teams for the next month to continue improving on those behaviors. Thank you so much for that question. And also, Paula, if you have anything more specific, feel free to chat that in because we can answer that if you have anything else you'd like to know about that.
Yeah, that's great. The only thing I would add, Emily, Paula, I think it's a great question because everybody wants to know, what's the impact of what we're doing? Are we making an impact? And it's such an important question. And one of the things I love about coaching is that coaching versus auditing, I guess I should say, is that you get that immediate sense of making a difference on the spot just by the questions that you're asking, because sometimes what you'll find when you get into a coaching situation is just by asking the questions that you're asking, you can see the light bulbs going off in people's heads, and you can see them saying, oh, interesting, I never thought about that, or oh, wow, I'm glad you brought that up. I was thinking X, and you were really thinking Y. Let's get on the same page. You can almost see that impact immediately, which is really cool. But then, obviously, you could take it a step further, like Emily was talking, and really formally collect some data and really quantify the changes that are happening out there. But great question. Thank you.
Thanks, Jeff. We've got another question that came through. The question is, can you tell us more about how the OAMS framework is helpful with coaching and developing the right solutions?
Yeah, that's a great question. And again, the OAM framework is very useful, as we've said, for actually helping to diagnose a barrier or a root cause. And when we look at this, the opportunity and the ability and the motivation, what you're trying to do is when you're making this observation, you're actually trying to process and think through what could be the root cause of why they're not performing this behavior. And so Stapan had given you a few examples of that, but one thing that we've, like for example, is if you see someone that's maybe not performing a behavior like taking a blood pressure, you really need to think through, is the environment around them not conducive to them taking blood pressure? Do they not know how to take blood pressure? Or do they have the time and they know how to do it, but they're just not really wanting to do it right now for some other type of internal reason? And so the reason we use this framework is that as a coach is it really gives us the time to think through what could be the root cause of this. And then by identifying that, you're able to coach them specifically in that direction. So if it is an opportunity barrier, like there's just really no time for them to actually perform that task, you can maybe brainstorm with them how, what is needed to give them more time. Is there a way that we can have another staff member come in and be available? Is there a time or a way that we can bring in more support or actually have the nurse leader provide more resources for that person to do it? Or for the ability, that's usually much simpler and straightforward because maybe they just need to be shown how to do it or given the confidence needed to actually take the blood pressure. And then again with the motivation, that's the hardest one, I would say, when you're coaching, because that's where you have to get very creative to figure out what is it going to take to motivate this person to actually complete this task if all the other things are there for them to do it. And so again, this is not very simple all the time. It does require practice and really thinking through this and getting to know your team. But that's why we really recommend, you know, practicing going through this with people and really thinking through it when you can, and having conversations with the people around you to get better at thinking through and diagnosing barriers and then finding those solutions.
Thanks, Emily. Looks like we've got another question that came through the chat. Can you please briefly go back and talk about when to do coaching?
Absolutely, yeah, happy to take that one. And I think, you know, it comes back to, you know, once you've rolled out whatever the intervention you're talking about is, and so this clearly, you know, we're talking about, you know, the BetterBirth scenario here, but whatever the intervention happens to be, once people are educated on what the intervention is and how to use it, you know, it's sort of making that distinction between the education and the coaching piece. You've got to set the people up for success. They have to know what the expectations are. You've got to do that education piece first, and then start thinking critically about where you're going to start, so which team you're actually going to work with. I talked about that earlier. You know, pick a team that has been enthusiastic about the intervention that you want to try, whether it's a checklist, whatever it is, doesn't really matter. Start with a team that's energetic and interested in doing it and really wants to try to learn how to do it better, and start focusing your coaching there, you know, by observing that team and getting good at what it is that you're doing and practicing with them. And then as you get better at what you're doing, you're going to become a better coach. You're going to craft your questions better. Then you can start moving on to some of the teams that'll be a little more challenging to work with, if you will. Anything you want to add to that, Emily?
No, I think that you said it perfectly too, and to really consider, you know, picking the people that want to get better and want to improve and that you have a strong relationship with at the beginning is a great place to start. Mm-hmm.
Absolutely. And one other point I wanted to add too, related to the last question around the framework there, I think, you know, as coaches we need to take sort of a systems view of you know, the environments that we work in, you know, and as a human factors person, you know, it's really easy to get caught up in, you know, the individual behaviors, but what we've learned, you know, in all the years of looking at why people behave the way they do, often they do that because they're set up to behave a certain way. And so whether they don't have the opportunity to do the right thing, or they're lacking certain skills or abilities, you know, they don't have the equipment, the materials, the environment's not right. All those things are system factors that set people up to make mistakes and not perform the way we had intended them to perform. So I think it's really important to take that systems level view and get the focus sort of away from the individual. Now ultimately you may find that there are some individuals that that it's an individual issue with them and they can be dealt with on an individual basis. But I think taking that systems level view is really important from the beginning. So I think that's why that framework really helps to sort of conceptualize what coaching is all about, if that's helpful.
Thanks, Jeff. It looks like we have one more question. We probably only have time for one more question. The question is, where can we find the observation tool that was showed earlier in the webinar?
Great question. You can actually find that on the Ariadne Labs website. Wait, Jim, is it on our website?
It's on our portal website, the Ariadne Labs BetterBirth community. And I think actually the next slide has all those addresses on it if you want to push forward a little bit.
Yes. I just wanted to make sure before I said that, but yes, so if you actually go onto the Ariadne Labs website and join the online portal, you will find not only access to the implementation guide and the observation tool, but you will actually also be able to download the webinars from the past if you want to go back and watch those, and the one from today will actually also be posted there as well. And you can find a variety of tools from our other programs as well. And then, so as I mentioned earlier, the next webinar in this series will be held in February, and we can actually send along more information and resources from this webinar to you via email. And if you have any follow-up questions from today's webinar, specifically around coaching, down at the bottom here is the email address where you can send them, and we would love to hear from you, or if you have any feedback, or if you'd like any more information that we can provide for you, please just shoot us an email and let us know, and we'd be happy to hear from you and send you anything that would be helpful. And with that, I think that we are finished for today. We are so thankful that you were able to join us, and we look forward to hearing from you again in February. Thank you so much, everyone.